Until 4 days ago, I was perfectly okay. Then I had this little fever, or I had this little vague unwellness or something, and then I did a routine blood count, and the next thing I know, doctor is telling me I got blood cancer. So the history seems very abrupt and sudden. Is there any particular reason for this, and is this the normal? And what are the difficulties you actually encounter in diagnosing cancers in blood?
So if we talk about the cancers and blood component, like as we are talking with you that food and alcohol and smoking majorly impacts all the solid organ cancers, but per se to our hematological cancers, to a certain extent we can say that it doesn't influence as much as the solid cancer, food, alcohol and smoking. Having said that, we should refrain from that to avoid the other solid organ cancers. But in blood also there are slow growing cancers and fast growing cancers. So if it is a slow growing cancer, it takes many months to years for the patient to get symptomatic and then get notified by a physician. Whereas if we take some of the fast growing blood cancers, it doesn't even give us time. So it just develops, which are called as acute leukemias. Commonly in our practice, we see something called as ALL and AML, acute myeloid and acute lymphoid leukemia, which for a matter of fact, the cell growth is so fast that it presents hardly in a weeks to months time. So usually the first notification itself will be to a physician who sees this very high counts and then gets diagnosed with cancer.